This video demonstrates the surgical technique of single graft double bundle posterior cruciate ligament reconstruction using the peroneus longus tendon. The knee unit of the orthopedics department at the University of Cape Town receives educational grants from Smith & Nephew and Medacta. The ALB and PMB footprints are first identified on the femur. An arthroscopic shaver is then used to debride the PCL remnants on the tibia. The tibial attachment of the PCL is visualized. An eyelet pin and reamer is placed over the ALB attachment site on the femur to check tunnel placement. The eyelet pin is then drilled through the femur on the ALB attachment site. A 4 mm tunnel is reamed over the ALB eyelet pin through to the far cortex to allow passage of the suspensory fixation device at a later stage. An 11 mm reamer is subsequently used to ream over the ALB eyelet pin to a depth of 25 mm. The ALB tunnel edges are debrided with an arthroscopic shaver to allow smooth graft passage. An eyelet pin is then drilled through the PMB attachment on the femur. A 7 mm reamer is used to ream over the PMB eyelet pin to a depth of 25 mm. The ALB and PMB tunnels are separated by an adequate bone bridge. The PCL drill guide for the tibial tunnel is placed over the central portion of the tibial PCL attachment. A guide pin for the tibial tunnel is drilled in a prograde manner using the jig under direct visualization through the anterolateral portal. The tibial tunnel guide pin is carefully advanced. An arthroscopic wire catcher is placed over the guide pin tip prior to reaming. A 12 mm reamer is used to ream over the tibial guide pin, taking care to protect the neurovascular structures posteriorly. Passing sutures are advanced into the knee joint through the tibial tunnel. Passing sutures are pulled out of the knee joint through the ALB and PMB tunnels along with the tibial passing suture using the arthroscopic suture manager. After the passing sutures are brought out via the medial portal, the graft is inserted via this portal. The tibial portion is passed retrograde, and the ALB and PMB bundles are passed prograde. The ALB and PMB portions of the graft are pulled into their respective tunnels to the marked depth. The PMB graft is secured in its femoral tunnel with an interference screw. The PMB graft is then tensioned with a knee in extension through traction on the tibial portion of the graft. An interference screw is inserted prograde in the tibial tunnel under direct arthroscopic visualization while the graft is tensioned with the knee in extension. A tibial tunnel view is utilized to ensure that the interference screw is placed deep enough. To avoid advancing the screw past the tunnel, intra-articular visualization of the far cortex of the tibial tunnel or a fluoroscopic image of the screwdriver tip during advancement can be used. The ALB portion of the graft is then tensioned with the knee in 90 degrees of flexion using the suspensory fixation device. The ALB graft is shown to tighten in flexion. The PMB graft tightens in extension. Thank you for watching this video.